Anita Puddicombe. She will speak on the trials and tribulations of rural telehealth. And I did find something out really interesting about Anita. She was just presented with the Premier's Award of Excellence for her distance delivery initiative in children's health services. So I will turn this over to quickly to Anita, and please go ahead.
Hi, good morning. Thanks for your attention this morning. My name is Anita Puddicombe with Aspen Regional Health. Currently with Aspen, we're part of a little bit of the change we've been having in our health sector and part of the new Alberta Health Services. So thank you very much for joining. So with Aspen, formerly Aspen, we are the Region 7 and pretty much stretch across part of the border, and part of the problems have been being able to connect all the remote sites to be either internal into our region or else to be able to access any special services that are available at more of the urban areas. Tertiary areas. We access some of our services from Capital Health and as well through Children's Services, Alberta Mental Health Board, and we're working on a speech-language pathology program with connecting our speech-language pathologists, which are limited resource in our area, to the schools with either their own equipment or in some instances we have installed units at a couple of the schools to be able to offer that service. So we have approximately 39 units throughout our former region at various healthcare centers and community health services in our area. So as I mentioned, our goal has been to be able to offer these kinds of services, whether or not they're a teleclinical service or to them as well as to some of our staff and healthcare professionals by offering them the ability to hook up to telelearning and teleadministration sessions throughout the whole province, whether or not they're hosted in our own region or say from Capital Health or Alberta Mental Health Board. There's numerous education opportunities that we offer to our staff and also to our various partners that are in our communities, whether they're with Children's Services, whether or not they're part of ADAC or CASA. Basically, if it's health related and you're interested in attending, you're welcome to attend at any of our healthcare centers to take advantage of that and not having to travel to wherever it is you need to. So a lot of our sites in our region, we had to be able to access everybody, and using that, we switched over all of our dial-up network over to internet protocol to IP so that we could access the SuperNet to be able to connect both throughout our, as I mentioned, in our own region to each our own sites, as well as to be able to connect to Capital Health directly for specialist services such as telepharmacy. We have a teleophthalmology, telecardiology that we are able to access, as well as mental health services, which has been one of our number one, I guess, one of our highest clinical services that we offer to our staff. And mental health was one of the first, I guess, players on the board as far as our region being able to connect and offer that type of service. So we've had these types of services offered for our clients since 2000.
My apologies, Anita. I'll have to ask you to sort of shorten up your presentation here. We're running a little bit short of time.
Oh, you bet. I'll speed her up. I can talk fast.
Thanks so much.
You bet. As well, so what we basically do is we determine what our needs in our community, who do we need to access to be able to connect them to us so that we can offer that service. And that takes just basically getting everybody involved in the initial planning stages so that we can try and cover all obstacles that we can, whether or not it's technology that they need help with, or whether or not it's do they have the network capability? Do they have IP? And do they have the equipment? Do they know how to use it? Do we have the staffing, the money, facility, at the room at the facility? So as I mentioned, we have a lot of partners that we connect with for various needs. Just bringing together whoever needs to come together to be able to offer a service to a client from whatever community it happens to be. We connect up with several. A regular one we do with education, as I mentioned, is our speech language pathology. As well, we have hooked up nursing sessions for Grant McEwen nursing students that are doing a work experience at our hospital. So as I mentioned, we all basically just need to talk the same language to be able to communicate, whether or not what type of video conferencing equipment we have. In health, I forgot to mention, we refer to it as telehealth, same thing, and whether or not we can connect with IP and using the SuperNet, or if we have to use a bridge. And we use a multiple of services, our video conference scheduling system, to coordinate all of our sessions with health sectors and as well as education and the TMS. Any questions?
Just a question.
Illuminate.
Yes, I haven't seen any questions yet, but I just have a question from myself, Anita, here. It looks like you've done a fabulous job with integrating your services and your technology. Do you have a project plan that you would make available for sharing with people who would look at doing an initiative like this?
I can certainly be contacted if somebody wants to send me an email, and I can go through some of the different project plans. They kind of vary between whether or not I'm working on a children's services project or if it's more pertinent to an actual project in a community, but definitely.
Excellent. You sound like a fabulous resource. I'm not seeing any questions, so thank you so much, Anita, and for taking time, and thank you for being kind enough to condense